Hi, it's Bianca Martinez, and I'm going to be doing our week 5 demonstration videos. I'm going to begin with our first patient that I'm going to pull up in the MAR. It's going to be Stanza Stark, date of birth 2/21/1990, here with the diagnosis of heart failure. She has an allergy to penicillin, and she has an order that was just put in by Dr. Who for Lanoxin 0.25 milligrams PO daily, and there is an order to hold it if her heart rate is to go below 60. So once we have confirmed the medical order, we're gonna go ahead and go into our Pyxis. We are gonna go pull up the Lanoxin that was ordered, which is a tablet form medication. We are gonna do our second medication check for Stanza Stark, date of birth 2/21/1990, here with the diagnosis of heart failure, and she has an allergy to penicillin. The medication was ordered by Dr. Who, and it is Lanoxin at 0.25 milligrams PO daily, with an order to hold it if her heart rate goes under 30. Before we leave with the medication, you want to make sure that it has not expired. The expiration date is 6/20/36, so we're good to go. So we're gonna grab a medication cup as well. We're gonna head over to our patient's room, knock on their door. We are gonna close the curtain for privacy. Gonna do some hand hygiene, and we're gonna introduce ourselves to the patient. Hi Sandra, my name is Bianca. I'm gonna be your nurse today. I'm here to give you your medication for your diagnosis of heart failure. I see that you have an allergy to penicillin. Do you have any questions for me? If they haven't taken the medication, you just want to give them a brief description of what it's going to help them with. The Lanoxin that Dr. Who ordered for you is a medication that works that it slows and it helps strengthen your heart contractions. After you take the medication, we will be checking your blood pressure, heart rate, and with your next labs that are ordered, we're also going to be checking your potassium levels. There is a side effect that it can cause some dizziness and lightheaded. So if you are getting up or you need help turning and all of a sudden you feel lightheaded, please go ahead and give us a call with the call light, and we're gonna come straight to your room and give you some help. Okay, once you give the patient a brief description of the medication, we're gonna go ahead and do our final medication check by looking at the medical bracelet. Hi Stanza, can you repeat your name and date of birth for me? Stanza Stark, date of birth 2/21/1990, here for a diagnosis of heart failure, and she has an allergy to penicillin. And we're going to go ahead and be giving her Lanoxin at 0.25 milligrams PO daily. If her heart rate is lower than 60, we're going to hold off on the medication. Okay, hi Sandra, so do you have any problems swallowing? No? Do you mind drinking a little bit of water for me? Okay, so we're going to have the medication ready in the medication cup. Here you go. Drink of water. Dispose of the garbage into the trash can. Hand hygiene. Do you have any questions, Sandra, before I leave? Like I said, a brief reminder, if you start to feel lightheaded or dizzy, please go ahead and give us a call with the call light. We're going to be checking your blood pressure, heart rate frequently, just to make sure your blood pressure hasn't dropped, because that could be a side effect. And if you have any questions for me, like I said, don't hesitate to give me a call with a ring with the call light. So once we're done with the patient, we're going to document that that Stanza Stark was given Lanoxin at 0.2 milligrams PO daily. Okay. On to our second patient that we're going to pull up in the MAR. It is going to be James Smollett, date of birth 8/10/1985, here for a diagnosis of hypertension. There's no allergies that are listed in their file, so we're probably going to make a note and ask the patient if they're aware of any allergies they may have. Dr. Who ordered hydrochlorothiazide at 12.5 milligrams PO daily. So now our next step is we're going to go ahead and go to our Pyxis. We're going to pull up the medication, which is another tablet form. Hydrochlorothiazide. We're going to do our second medication check at this. James Smollett, date of birth 8/10/1985, here for a diagnosis of hypertension. There's, we mentioned before, no allergies are in their record, so we're going to ask the patient. And Dr. Who ordered hydrochlorothiazide at 12.5 milligrams PO daily. We're going to check the expiration date to make sure the medication is still good. 12/20/23. Okay, once we are done with our second check, we're now going to head into our patient's room. We're going to begin by knocking on the door, closing the curtain, do some hand hygiene, introduce yourself to the patient. Hi James, my name is Bianca. I'm going to be your nurse today, and I'm going to be giving you your medication for your hypertension. I noticed in your record that there wasn't any allergies listed. Are you allergic to any medication or anything that we should know about? If they reply no, okay James, I'll go ahead and update that in your medical record. That way they're not asking you every single time a different nurse or doctor sees you. Okay, James, we're gonna begin by doing our third medication check. Looking at the medical bracelet, James Smollett, date of birth 8/10/1995, here with the diagnosis of hypertension. Dr. Who has ordered hydrochlorothiazide at 12.5 milligrams PO daily. Before I give you the medication, James, do you have any questions about it? No, so you've taken your blood pressure medication before. Okay, so if they don't have any questions, then just let them know. We're going to be checking your blood pressure and your potassium level with your next blood work that's ordered. We're going to go ahead. James, would you mind drinking some water for me to make sure you don't have any problems swallowing? If it all checks out, we're going to give him the medication now. Okay. Some water. Toss the garbage into the trash can. Hand hygiene. Okay, James, like I mentioned before, we're going to be checking your blood pressure and your potassium levels. There is a chance it can possibly lower your BP, but if you start to feel lightheadedness, don't hesitate to give us a call with a call aid, and we'll send somebody your way. That way we can help you go to the bathroom, even just to sit up or help you turn around. If they have no more questions, okay, we're going to document that James Smollett was given the hydrochlorothiazide at 12.5 milligrams PO daily. Our next patient that we're going to pull up in the MAR is going to be Taylor Swift. Date of birth is 7/21/1980. Here for angina. She has an allergy to penicillin. Dr. Who has ordered one NitroTab SL now, and also a Nitro Pace ½ inch. So once we have reviewed the order, we're going to go ahead and go to our Pyxis. We're going to do our second medication check. I'm going to begin with the tablet, the Nitro SL. And pull up the Nitro Pace. We're going to check the expiration date on both medications. The tablet expiration date is 9/20/23, and for the Pace, it does not expire until 2024. So both medications are still viable to give to the patient. We're going to do our second check on both medications. For Taylor Swift, date of birth 7/21/1980, here with the diagnosis of chest pain with an allergy to penicillin. Dr. Who has ordered one NitroTab SL now and ½ inch Nitro Base now. We're going to go ahead and grab our medication and go into our patient's room. Close the curtain for privacy. We're going to do some hand hygiene. Hi Taylor, my name is Bianca. I'm going to be your nurse today. How are you feeling? Is your chest hurting? What's the pain level that you're experiencing? An 8. So normally pain levels we want for chest we don't want them to be feeling any pain, so they should be at a 0. Okay, I'm going to go ahead and order an EKG and labs, check your blood pressure, and I'm going to go ahead and bring in the medication that Dr. Who has ordered. So he has ordered a nitro tablet for a medication that we're going to put under your tongue, and then a paste that I'm going to put on your chest. Before we give the medication to Miss Taylor Swift, we're going to go ahead and do our third medication check by looking at the medical bracelet. I'm going to put on my gloves for Taylor Swift. Date of birth 7/21/1980. Here for a diagnosis of chest pain, which she's complaining about. Has an allergy to penicillin. And Dr. Who has ordered the nitro tab, 1 now, and half an inch of nitro paste now as well. So once we have done the EKG and monitor her heart rate and blood pressure, we're gonna get half an inch of the nitro base, doing it on the blank side. Let's see, squeeze. And I should mention, before putting the paste onto the paper, make sure you put the date, time, and initials that you're going to be placing it on the patient. So we're going to go ahead and grab some medical tape. Okay, Taylor, do you have any problems swallowing? This tablet goes under your tongue and it actually dissolves, but I'm going to give you some water, that way your mouth is not dry. Okay. Open the tablet. I'm going to place it under your tongue. Don't chew it, swallow it, just let it dissolve. That way it gets into your system correctly. I'm going to be back in 5 minutes to see how your pain is. So I'm going to pretend to be taking off my gloves, hand hygiene. Come back within the 5 minutes. Hi Taylor. Close the curtain again for privacy. How's your pain level about now? About a 4. Okay, so we're gonna go ahead and do our second tablet of nitro. I would probably do this another medication check just to be safe after you have it with you. So gonna be for a nitro SL tab for Taylor Swift, date of birth 7/21/1980. Here for a diagnosis of angina, and she's still experiencing a pain level of 4, and her BP is still kind of high, so we're going to document that we're going to give her the second nitro dose. Before you touch the patient, make sure you do hand hygiene. Okay, I'm going to remove my gloves since we're not putting any more paste on her. Hand hygiene again. So go ahead and get the second tablet, put it under her tongue, wait for it to dissolve. Okay, hand hygiene. And Taylor, I'll be back in another 5 minutes just to see how your pain level is. Come back. Hi Taylor, it's me, Bianca. How's your pain level right now? Hand hygiene. At a 0. Okay, so we don't have to give you that third dose of nitro. So a side effect from the nitro medication is you can experience a headache. Do you have any headaches right now? They reply no. Okay, so we're still going to be monitoring your chest pain, your blood pressure, since it's in the normal range right now. And with the blood work, we're going to be looking at your enzymes. Do you have any questions for me? They reply no. I'm going to leave the call light really close to you. That way, if you feel any pain, any dizziness, any headaches, you give us a call. We'll be right in. So we're going to document that Taylor Swift was given 2 doses of nitro SL tabs. So the next patient we are going to be treating that we're pulling up in the MAR is going to be Miss Tixie McCall. Here, date of birth is 3/6/1980. 1968, diagnosis of hyperlipidemia. She has no known drug allergies, and Doctor Who has ordered Lipitor 10 milligrams PO daily. We're going to go ahead and go into our Pyxis. Lipitor is a tablet medication. We're going to check the expiration date, 9/20/38, so the medication is still viable. We're going to do the second medication check before we leave the medication room. Dixie McCall, date of birth 3/6/1968, diagnosis of hyperlipidemia, allergies, no known drug allergies, and Doctor Who has ordered Lipitor 10 milligrams PO daily. We're now going to be going into the patient's room. Begin by knocking on the door, closing the curtain, hand hygiene. We're going to be introducing ourselves. Hi Dixie, my name is Bianca. I'm going to be your nurse today, and I'm here to give you your Lipitor medication that's here to help you with your hyperlipidemia. Have you taken it before? No, so the medication that doctor ordered, the Lipitor, is going to help lower your cholesterol level. It's important if you're going to, I would just suggest if you're going to try to avoid drinking grape juice because it does not mix well with the medications. If they don't have any more questions for you, we're going to do our third medication check by checking the medical bracelet for Dixie McCall, date of birth 3/6/68, diagnosis of hyperlipidemia, no known drug allergies, and Doctor Who has prescribed Lipitor 10 milligrams PO daily. Do you have any problems swallowing, Dixie? No? Okay, do you mind drinking some water for me? Okay, once you see they have no problem swallowing, go ahead and give them the medication. Drink a water, dispose of the medication trash. Hand hygiene. Do you have any questions before I leave, Dixie? No? So just some side effects to be aware of. It can cause you to feel a little dizzy or even result in diarrhea. But if you start to feel dizzy with just even sitting up after laying down, or you need help going to the bathroom, please let us know by using the call it, and we'll send help your way immediately. And just another friendly reminder to try to avoid drinking grape juice while on this medication. Before we leave the room, we're going to document that Dixie McCall was given Lipitor 10 milligrams PO daily for her diagnosis of hyperlipidemia. Our next patient is going to be Amy Farrah Fowler, date of birth 10/22/1967, and the MAR shows that she is here with the diagnosis of fluid retention, has an allergy to penicillin, and Doctor Who has ordered Lasix 20 milligrams PO daily. We're going to go ahead and one thing before getting either because the medication can be given in a tablet or IV, I would personally go introduce myself into the patient and hear her chest to see if she's having any shortness of breath or crackle sounds, because depending if that were the case, I would call the Doctor Who and let him know the patient Amy Fowler is experiencing shortness of breath and her chest sounds like crackling noises, and see if he would like to order the Lasix and IV version just to be on the safe side. We're going to go in the room. Hi Dixie, I'm going to be your nurse. Privacy before you introduce yourself, hand hygiene. I'm just going to take a quick listen to see what's the best way to give you your medication. Are you having any shortness of breath? I am hearing a little crackling, so I'm going to give Doctor Who a quick call to see if he would like to give your medication through the IV. So we're going to leave the room, hand hygiene. And we're going to call Doctor Who, let him know that Dixie Farrah Fowler, date of birth 10/22/1967, is experiencing shortness of breath and having some crackling noises, and that it would be my recommendation if to give it through the IV. If he says yes, so now we're going to go into the medication room. We're going to prepare our Lasix. So I'm going to put on my gloves for this. gonna open our vial of 6 with the alcohol wipe. We're gonna clean the top. Get the syringe from one ear. Pretend like it's going into an IV. We are gonna draw up 20 milligrams. You want to make sure you have no bubbles in the syringe. So just no more bubbles. We're going to put on our safety with the one-hand method. Okay. Now it's closed. Before actually preparing the vial, I just messed this up. You want to make sure the Lasix liquid form is expiration date has not expired. We're going to do our second medication check before we leave. It is going to be for Miss Amy Fowler, diagnosis of fluid retention, date of birth 10/22/1967. She has an allergy to penicillin, and Dr. Who has ordered Lasix 20 milligrams through an IV since we saw that the patient was experiencing shortness of breath and crackling noise in her chest. I'm gonna say I'm removing my gloves before I leave the medication room. That way you're not walking in the hospital with gloves on. We are now gonna go into the patient's room. Close the curtain. Hi Amy, it's me again, Bianca, your nurse. I spoke to Dr. Who and we're gonna go ahead and give you your medication through the IV. Do you have any questions for me? No, you feel safer with it going in your IV with your chest hurting? I agree too. So we're gonna go ahead and do our third medication check. It is gonna be for Amy Fowler, date of birth 10/22/1967, here with the diagnosis of fluid retention. And Dr. Who went ahead and changed the order to Lasix 20 milligrams through the IV. Before the third check, I forgot to mention you do the hand hygiene. So now I'm gonna re-put on new gloves. With Amy being older, I'm gonna go ahead and give her shot in through the IV. So I'm gonna go ahead and pretend that this is the IV bottle. With a different alcohol pad, we're gonna go ahead and clean the IV area where the port is with the syringe to put in the medication. One important thing is Lasix IV form medication. You want to make sure you're pressing very slow. Once we're done, we're going to go ahead, since we are reusing it, we are going to do the one-hand method. Okay. We're now going to throw our needle into the sharps container. Remove our gloves. Hand hygiene. Okay, Amy, do you have any questions for me? If you start to experience any dizziness, headaches, or any more shortness of breath, or that crackling in your chest is starting to hurt, please don't hesitate to call me and I'll call your provider, see if there's anything else that he would like to give you for the pain. Before we leave the room, we're going to go ahead and document that Amy Fowler, date of birth 10/22/1967, with the diagnosis of fluid retention, was given Lasix 20 milligrams through an IV. We're now going to be doing the last patient. We're going to pull up in the MAR, Miss Linda Pelcher, date of birth 9/4/1972, here for a diagnosis of atrial fibrillation, allergy. She has no known allergies, and Dr. Who has ordered Coumadin 5 milligrams PO daily for the atrial fibrillation. We're going to go ahead and go into our Pyxis. We're going to pull up our Coumadin. Check the expiration date 10/20/37. Do our second medication check for Miss Linda Boucher, 9/4/1972, here for a diagnosis of atrial fibrillation. And Dr. Who has ordered Coumadin 5 milligrams PO daily. So once we have the medication, we are going to head into our patient's room. Begin by knocking on the door, closing the curtain for privacy, hand hygiene. Hi Linda, my name is Bianca. I'm going to be your nurse today. I'm going to go ahead and give you your Coumadin for your atrial fibrillation. Do you have any questions about Coumadin? So Coumadin helps with your heart beating a little faster or irregular. It's going to help prevent the formation of any blood clots. No more questions. So we're going to do our third medication check. It is going to be for Linda Boucher, date of birth 9/4/1972. Here with the diagnosis of atrial fibrillation. Dr. Who has ordered Coumadin 5 milligrams PO daily. Do you have any problems swallowing? No? Do you mind taking a drink of water for me? Okay, so now we're going to, after doing our third check, we're going to give Miss Linda Boucher her Coumadin. Some water. Discard the garbage into the trash can. Do you have any questions for me, Linda? None? So we're going to go ahead and document that Miss Linda Boucher was given her Coumadin 5 milligrams for her atrial fibrillation by Dr. Who. That was ordered by Dr. Who. Hand hygiene. And like I said, remember to document.